My oldest son has autism, and when he and my other children and myself moved back to Spokane in 2000, he was about 4 years old. And I was really nervous about the move because I had looked around and there weren't any services for children with autism here in Spokane. So I was really nervous about moving here. I wanted to move here because my family was here and my friends were here, but I wasn't sure it was going to be the right choice for my son. There was a lot of resistance in many parts of the medical community around embracing autism and everything that came with it during that period of time. And I think that what made that harder is the healthcare system didn't have a really good language around how to approach autism and what to do when a family walked through the door. One of the first people I met when I moved to Spokane was a developmental pediatrician here, Dr. Peter Holden, who also became the primary care physician for my son. And he also was interested in seeing if there was something that we could do on a larger level in Spokane. So we began a group called the Spokane Autism Task Force. And that group invited other physicians, other stakeholders in the community from higher education, public education, other family members, other providers of services to come together and start talking about where the needs were. And the task force had made it clear that they believed a huge need at that time was education. Education for community members, for school districts, for other families, just a lot of information about autism. People at that time frequently weren't even familiar with the word. I think some of the biggest achievements at that time were finding individuals who are willing to commit an awful lot of their time and expertise to make that happen. We also had a university professor lead us through creating a mission statement and a vision, not only for the Spokane Autism Task Force, but for what we hoped would be a new organization. And during the course of that, it became clear that we needed an entity that was willing to continue advocating for and building access to necessary services and supports. And that is the mission and the vision for Northwest Autism Center. So the first task was to go about creating a nonprofit, a federally and state-approved nonprofit agency that was capable of advancing that mission statement, implementing it, and then collecting and securing funds to help provide it. The initial board members came from finance, law, strategic planning, and I'm thrilled to say that we still have two of the original members on our board. This is an example of meetings that the individual participants may have thought, oh, why? Why am I here? What is this going to do? Where is it going to take us? And yet that effort that was expended by all of these people, some of whom are still working and running respective agencies, organizations, working in higher ed, are still out there, helped create the direction for Northwest Autism Center, and I'm really grateful for that. There have been so many people who have become part of Northwest Autism Center as an employee, as a board member, as a volunteer, and those individuals, there's been a season and a time for each of those interfaces, and we needed it. Needed them, needed the time that was given, the money that was given, the support that was given, and we appreciate everyone. So whether you were part of this effort 20 years ago, 15 years ago, or today, your contribution to making us who we are is no less valuable. It was critical. And to that, I just want to say thank you so much. We wouldn't be here without you.